The moment you get close to 65, your mailbox changes. Suddenly it is filled with glossy brochures, smiling faces, $0 premiums, dental benefits, gym memberships, and promises that make Medicare sound simple. But if you have ever stared at those letters and felt more confused than informed, you are not alone. Medicare is not one decision. It is a series of decisions. And the most important one is not just which plan looks cheapest today. It is which path gives you the care, flexibility, and protection you may need 10 or 15 years from now. So today we are cutting through the sales language. No pressure, no private insurance pitch, no confusing alphabet soup. Just a plain English explanation of how Medicare works in 2026, what the major parts actually do, and the decision many people wish they understood before they turned 65. Let's start with the foundation. Original Medicare has two main parts, Part A and Part B. Part A is hospital insurance. It helps cover inpatient hospital stays, skilled nursing care under certain conditions, hospice care, and some home health care. Most people do not pay a monthly premium for Part A because they or a spouse paid Medicare taxes long enough while working. But premium-free does not mean cost-free. In 2026, the Part A hospital deductible is $1,736 for each benefit period. That phrase matters, each benefit period. It is not simply one deductible for the entire year. Part B is medical insurance. This helps cover doctor visits, outpatient care, preventive services, lab work, durable medical equipment, and many services you receive outside a hospital admission. Unlike Part A, Part B usually has a monthly premium. In 2026, the standard Part B premium is $202.90 a month, though higher income beneficiaries may pay more. Part B also has a $283 yearly deductible. After that deductible, Original Medicare usually pays 80% of the Medicare-approved amount for covered services, and you are generally responsible for the remaining 20%. And this is where the first major warning comes in. Under Original Medicare alone, there is generally no yearly limit on what you could pay out of pocket unless you have other coverage, such as Medigap, Medicaid, retiree coverage, or another form of supplemental protection. Medicare is valuable, Medicare is important, but Original Medicare by itself does not cover everything. That leads to the fork in the road. Once you have Part A and Part B, most people face two broad paths. Path 1 is Original Medicare plus a Medigap policy, often called a Medicare supplement, and usually a separate Part D prescription drug plan. Path 2 is Medicare Advantage, also called Part C, where a private plan approved by Medicare provides your Part A and Part B coverage. Both paths can be legitimate. Both paths can work for the right person, but they work very differently. Let's start with Original Medicare plus Medigap. Medigap is private insurance designed to help pay some of the costs Original Medicare leaves behind, such as deductibles, co-payments, and co-insurance. The exact help depends on which Medigap plan you choose. The major attraction is flexibility. With Original Medicare, you can generally see any doctor or hospital in the United States that accepts Medicare. You are not usually locked into a local provider network. For people who travel, split time between states, or want maximum freedom to choose specialists, that can be a major advantage. But this path usually costs more each month. You keep paying your Part B premium. You pay a Medigap premium, and if you want prescription drug coverage, you usually buy a separate Part D plan. So the trade-off is simple. Higher predictable monthly costs in exchange for broader provider access and fewer network restrictions. Now let's look at Medicare Advantage. Medicare Advantage plans are private plans approved by Medicare. Many include prescription drug coverage. Some advertise $0 premiums. Many offer extras Original Medicare does not usually cover, such as dental, vision, hearing, transportation, or fitness benefits. That is why the brochures look so appealing. But the trade-off is structure. Medicare Advantage plans often use provider networks. That means your doctor, hospital, or specialist may need to be in the plan's network for you to get the best coverage. Many plans also use prior authorization, which means the plan may need to approve certain services before it pays. This does not automatically make Medicare Advantage bad. Some people are happy with their plans, especially if their doctors are in-network. their medications are covered, and they are comfortable with the plan's rules. But you need to understand what you are choosing. A low premium on day one does not tell you what happens during a serious illness, a surgery, a cancer diagnosis, or a move to another state. Medicare Advantage plans do have a yearly out-of-pocket limit for covered Part A and Part B services. That is an important protection. But the limit varies by plan, and you must follow the plan's rules. So before you choose an Advantage plan, ask 3 questions. Are my doctors and hospitals in network? Are my medications covered at a price I can live with? And what is the maximum I could pay out of pocket in a bad health year? Those 3 questions matter more than the dental benefit on the postcard. Now we need to talk about prescription drugs because Part D changed in a major way. If you have original Medicare and Medigap, you usually need a separate Part D plan. If you have Medicare Advantage, drug coverage may already be included, but you still need to check the details. In 2026, Part D has an important protection. Your yearly out-of-pocket costs for covered Part D drugs are capped at $2,100. Once you reach that limit, you pay nothing out of pocket for covered Part D drugs for the rest of the year. That is a major improvement for people who take expensive medications. But the cap does not mean every drug is covered. It does not mean every pharmacy has the same price, or that every plan charges the same premium, deductible, copay, or coinsurance. In 2026, Medicare drug plans can have deductibles up to $615, although some plans have lower deductibles or no deductible at all. That means Part D is not something you should set and forget. Every year, check 3 things. Are your medications still on the formulary? Did any drug move tiers? And is your preferred pharmacy still giving you the best price? A plan that was perfect last year may be expensive this year. And now we reach the decision that deserves the most attention. Your first Medigap enrollment window is extremely important. Under federal law, your Medigap open enrollment period lasts for 6 months. It begins the first month you have Part B and are 65 or older. During that window, you can buy any Medigap policy sold in your area. The company cannot use medical underwriting to deny you because of pre-existing health problems or charge you more because of them. But after that one-time window closes, the rules can change. Outside that period, you may have fewer choices. You may answer health questions, pay more, or be denied, unless you qualify for special guaranteed issue rights or your state gives extra protections. This is the part many people do not learn until later. If you start with Medicare Advantage because it looks cheaper, then years later want original Medicare plus Medigap, getting Medigap may not be as easy as it was at 65. That does not mean everyone should choose Medigap. It means the first decision deserves serious thought. Do not choose based only on the health you have at 65. Think about the access and flexibility you may want at 75, 80, or beyond. So here is the plain English summary. Original Medicare plus Medigap often gives more provider freedom and more predictable medical costs, but it usually costs more each month and usually requires a separate Part D plan. Medicare Advantage often has lower monthly premiums and may include extra benefits, but it usually comes with networks, plan rules, prior authorization, and out-of-pocket limits that vary by plan. Neither choice should be made from a television commercial, a postcard, or because a neighbor says, "This is what I picked, so you should pick it too." Your doctors, prescriptions, budget, travel habits, state, and health history all matter. Before you sign anything, get unbiased help. One of the best places to start is your local SHIP office, the State Health Insurance Assistance Program. SHIP counselors provide free, personalized Medicare counseling and are not connected to an insurance company or health plan. That last part matters. If someone is selling you a plan, they may be helpful, but they are not neutral. So here is the final warning. The most dangerous Medicare mistake is not simply paying too much this month. The bigger risk is choosing a path you do not fully understand, then discovering later that switching is harder than you expected. If you are turning 65 soon, write these 5 questions down. What will my monthly premium be? What is my worst-case out-of-pocket exposure? Are my doctors and hospitals covered? Are my prescriptions covered? And if my health changes later, how easy will it be to switch? Those 5 questions can save you years of frustration. This channel is not here to sell you a Medicare plan. It is here to help you slow down before making one of the most important healthcare decisions of retirement. Before enrolling, review your options on Medicare.gov, contact SHIP, and speak with a licensed professional who understands your state's rules. Now I want to hear from you. What part of Medicare confused you the most? Part A, Part B, Medigap, Medicare Advantage, or Part D? Leave your answer in the comments. Your experience may help someone else who is turning 65 this year. This is Senior Dossier, where we talk about the honest truths of life after 60. If this helped make Medicare a little clearer, consider subscribing. We will be here every week with calm, practical guidance for the next chapter of life.